Good evening, ladies and gentlemen, and welcome to the session on water-related health risks from climate change. Thank you all so much for persevering and choosing to spend the next 50 minutes or so with us here and showing the adaptation to the changing times and great resilience to tiredness. My name is Aleksandra Kazmierczak, and I have the pleasure of moderating this session. I am working at the European Environment Agency, where my main task is coordinating the European Climate and Health Observatory together with the colleagues from DG Klima and DG Sante. We will have three panelists today. Unfortunately, Oliver Schmoll from WHO Europe was unable to join us. He had to cancel at a very short notice. But I would like to introduce our other panelists. So we have Dr. Kata Farkas, who is an environmental virologist at Bangor University in Wales. We have Mr. Luca Lucentini, the director of the National Center for Water Safety at the National Institute of Health in Italy. And we have also Dr. Hans Dubois, who is a senior research manager at Eurofound, the European Foundation for the Improvement of Living and Working Conditions. So the aim today is to talk about the water risks to health under the changing climate. It was quite interesting to see that water safety and security took the sort of top spot among the indirect impacts of climate change as voted at the beginning of the plenary session. And I think that the last year's events in Europe left us really without doubt how the water quantity and quality is changing under the changing climate. The floods of last year and of 2021, the droughts, probably most of you have heard about the region of Catalonia already in February, implementing the water restrictions as a result of a drought that's been lasting for 40 months or so. And also the impacts on water quality through rising sea levels and the saline intrusions that are present also in Europe, not just in other areas. Then other river fish die out in 2022, and numerous other water quality risks. So we have a panel of our three star panelists to discuss some of those issues and solutions. And I would like to encourage you to post any questions and comments on Slido so we can have the discussion as well. But maybe I will shut up now and let our panelists actually introduce themselves and say what they are doing, starting from Kata. Over to you.
Can you hear me all right? Thank you for the introduction, Aleksandra. As you said, I am Dr. Kata Farkas from Bangor University. I've been there for 9 years now, studying viruses in water. My research focus is twofold. First of all, we do wastewater-based epidemiology to track case numbers in the community using virus numbers in the wastewater, which was, as you can imagine, greatly accelerated by the COVID-19 pandemic. The other more long-term part of my research is studying waterborne and zoonotic viruses and some other pathogens as well, which are emerging in the aquatic environment. Those pathogens that usually coming into the environment via wastewater, whether domestic or animal-related. And here where urbanization and global warming comes in, also for the reasons Aleksandra mentioned, and also because of the storm events, this kind of pollution is really flooding quite literally the aquatic environment, and it's becoming an emerging issue. Thank you.
Thank you, Kata. And Luca, would you like to tell us what
Good evening to everybody. I'm Luca Lucentini. I'm a civil servant from the National. And I said, that's okay. And I'm the director of the newborn National Center for Water Safety in Italy. And the main mission of the center is to support and demonstrate the access to water and sanitation, safe water and sanitation. At both national, we support with the research and surveillance the decision making and policy on water and health essentially, but not only. We will our main message is to enlarge this partnership, water and health, but also other sectors. And so in this view, we are pursuing an holistic risk analysis approach at the national level. And finally, I'm also really glad to be under the umbrella on the Dr. Schmoll in the protocol UN WHO protocol of water and health. I'm the leading of the co-leader of the program area on resilience of water system to climate change.
Thank you so much, Luca. And last but not least, Hans.
Yes, so I'm after the plenary, the last plenary, and looking forward to the discussion. So my name is Hans Dubois, and I work with Eurofound. It's an agency of the European Union, and we're based in Dublin, small office in Brussels as well. And I work with the social policies unit, and we are doing more and more things related to the environment, also together with the European Environmental Agency.
Thank you so much. So first, what we would like to discuss is where we are now and what the problems are. And then in the second round of questions, we would like to look a bit more into the future perspective and also the responses to the problems. But as mentioned, I would like to encourage you to post the questions via Slido, so we can also have a discussion. But to start with the problems, Kata, you are looking at the small things that are lurking in water and that can make us very ill or even kill us. So looking at your research, what would you see as the biggest threat in Europe in terms of the pathogens in water? What is the most dangerous?
There you go. There are a lot, as we heard about the vector-borne diseases, other pathogens coming out of nowhere. In terms of water-borne diseases, I think we need to focus on those emerging due to climate change and coming from tropical regions, same as the vector-borne diseases. It's just as the temperatures are rising, those pathogens that are more endemic at higher temperatures are becoming endemic in Europe and Northern America and so on. Like the West Nile virus is a great example for that. But there are waterborne pathogens where we see the same trends. For instance, hepatitis E virus, which causes gastroenteritis. It's originated from South Asia, but because of the frequent travels and climate change. Actually, there are more and more cases in Europe, including the UK, where we also detected the virus already in the aquatic environment and in coastal water bodies that are used for bathing or shellfish harvesting. And the main focus should be on these emerging ones, because now it's only a sporadic detection, but as we go on in time, it's just going to get worse, and there will be diseases caused by these pathogens coming from water. And it's also an emerging issue because temperature is rising. There's more and more people want to use water bodies for recreation, drinking, and so on. So we really need to keep an eye on those emerging pathogens. And it's not only viruses. If you think about AMR bacteria, so those that cannot be treated by antibiotics, also becoming waterborne, just because the sheer number of bacteria in the water is increasing, not that because they are very novel pathogens. And there are also those waterborne pathogens which are kind of vector derived. For instance, those causing swimmer's itch is becoming a problem as well in the colder areas because they are not as cold as they used to be. So the vectors and animal hosts are present in these areas. Same with any zoonotic diseases coming from warmer areas.
If I could ask a follow-up, is there anything that is actually decreasing or getting better, or are most of the pathogens and the diseases that are caused on the rise in Europe?
But overall, many things are getting better because of the improved sanitation. There's less waste, there are more centralized wastewater treatment. There are new methods to treat wastewater which do help. But in the developing regions, it is still a big health risks. And if they have a problem, everyone has a problem. Let's not forget about that.
Thank you. And now over to Luca, looking at the water quality more broadly from your national perspective in Italy. What would you see as the main water quality problem as driven by climate change?
Okay, I could start from a recent survey that covered, made by Water Services, covering 1/3 of populations. But let me, before precise that Italy is clearly well affected by all the drivers of climate change, from deglaciation to drought to flood. And we have a dynamic situation in source of drinking water, even if the infrastructure are very old, because we have basically groundwater as main source, but almost the 80%. But some regions that are the most dramatically impacted by climate change have just surface water as a source of water. So it's really important to have a broad and an extensive vision to water quality impact due to climate change, but the site specificity is really high in Italy, even because the dimension of water supply, which means, and the investment, which means the degree of resilience to climate change is really different. But in generally, all the water suppliers gave the message that they are more or less impacted by climate change in priority drought, then flood, and then increasing of temperature. But the emphasis was also given to the time of the gap among the extreme events and also the duration of these events that can do the difference in the degree of resiliency. The climate change are seriously impacting the treatments of water. Obviously, we already talked about the chemical and biological phases of the water, which means also availability of more or less nutrients, because climate change is aging also with soil and the chemical. The chemical equilibrium of water is also changing about this. We can do the example of selenium, that is an essential element, but it's also a dangerous element higher than some concentration. Now we are observing that selenium is stored by soil, so maybe it's important to have a more relaxed parametric value. This is an interesting issue for research, but also for surveillance. Anyway, disinfection and oxidation are really affected by climate change. So many, we have lots of problems also for algal loads and toxic production, and the other problem are related to increasing of temperature, even because some but our population is mostly old, and we have lots of vulnerable groups affected by biofilm formation and so on. So, but let me just conclude, because when you ask us to water quality, we obviously are focused on drinking water, and because of the exposure is direct for inhalation, ingestion, contact. But maybe we should have an effort, even as a health professional, to enlarge the concept of quality for one water, because we should start from the effectiveness of wastewater treatment and going also to the quality of the seas and oceans that are also source and reservoirs of all the contaminants. So these are challenging ways for which we have to approach the other sector that are energy, as an example for desalination, together with the water sector. So when we go into details, the problem, but also the solution, can be enlarged.
Thank you, Luca. So it's even more complex than we suspected when we came here. Maybe zooming out a bit and looking at the European perspective, and maybe touching a bit on the extreme weather events that are so damaging to health and infrastructure. Hans, Eurofound doesn't have a very long tradition of working on climate change, but you recently joined the European Climate and Health Observatory. And I also know that you've been doing some work on collecting policy responses from the European countries, looking how the countries are supporting the businesses and citizens, also the vulnerable citizens, after extreme weather events. So can you tell us a bit about that, and what have you learned from the countries' responses?
Yes, that's right. Through our EU Policy Watch database, we collected information already for a longer time on green transition policies. However, from the second half of last year, we also collected information on climate change policies. So it was first focused on mitigation mainly, but now also on policies related to extreme weather events. And when you look at these data, which by the way are accessible on the internet, I invite you to look at it, three things come to my mind, maybe more things will come to your mind when you look at it. But first of all, there are, really there's a wealth of policy responses. We recorded 59 of these policy responses, and there are probably more. However, most of these responses are really ad hoc so far. About 2/3 of them are financial support for victims of specific extreme weather events. It's mostly for agricultural businesses, but also for citizens who either have lost income by being unable to work due to an extreme weather event. So, for instance, Slovenia in 2023, last year, had a wage compensation for people who couldn't work because of the floods and the landslides. But there are also examples of compensation for citizens whose property has been damaged. So, for instance, in 2022, the Dutch compensation for people who were not insured against water damage. There's non-financial support, of course, deployment of emergency services. But more structural and maybe more interesting responses include, for instance, they're once-off funding, but they seek a long-term impact. Now, a nice example, even though it's related to fires, is Portugal, where areas affected could apply for funds to improve these areas in a way that would actually reinvigorate them, and prevent future fires from happening and from spreading, but also to stimulate them economically. But related to flooding, for instance, Estonia last year also had an interesting example where they identified 14 municipalities where the flooding risk were highest, so nothing had happened yet, but they were most at risk. And they used the money from the trading of greenhouse gas emissions allowances to fund projects proposed by these municipalities to prevent flooding from causing damage. Then there's also examples of cases where there's an upfront investment, but with open-ended running costs, like the warning systems, which were mentioned in the plenary already. So there are early examples of that, like in Bulgaria in 2012, for flooding in particular. Not only warning when it happens, but also warning what to do when it happens to the citizens and authorities. Then information portals, like in Czechia, Intersucho with Slovakia together. And then you have more open-ended system changes, such as, for instance, in Norway, an insurance which includes certain, also people living in less risky areas contributing the same, so that everybody is insured against the impact of floods and landslides. In Croatia, also the extension in 2019 of the concept of the natural disaster to include also extreme weather events for compensation. Actually, 70 to 80% of these of damages are due to water, so it's the most pronounced segment of that. But these things are not always new. Like there's a very old German system already in place, German Federal Civil Protection and Disaster Assistance Act, which helped, for instance, to react to the 2021 floods as well. Now, lastly, there's also measures which work through social protection, such as in France, unemployment benefits for people who get unemployed because of bad weather conditions. That was mainly for the construction sector, but actually for instance, in Greece, also the usual housing and minimum income schemes are used in when there was when people were not able to work because of extreme weather events. These existing benefits were extended in time, and that was the last point I wanted to emphasize. That it's not always specific things for these events which need to be in place to react quickly, but a general good level of social protection, so people have access to services and financial benefits, regardless of when they need it. That's key, and that's what we highlight in a forthcoming report on social protection 2.0. And we also give hints on how to green these social protection systems further.
Thank you, Hans. That's super interesting. And you said at the beginning that most of the responses are ad hoc, but the examples that you gave, I think that is really encouraging, that we see that there is some planning for future preparedness, or even preparing for the extreme weather events that have not happened yet, and that there's also this emphasis on solidarity and justice and support for the more vulnerable communities. So it's great to see those examples. I can see that there are some questions that are starting to come via Slido, but before we get to them, I wanted to ask our panelists a couple more questions. Looking more into the future in research, in policy and practice, Kata, starting from you, where would you see the biggest knowledge gaps when it comes to the pathogens in water, to waterborne diseases? What are the biggest unknowns and the blank spots that should be filled with research?
Thank you. Yes, there's a lot that we still don't know for sure. Oops. I won't be out of job anytime soon. Might be out of funding, but not job. First of all, a fun fact, which makes virologists cry all the time. In any metagenomes, there are up to 90% of the genome, of the metagenome, is unknown viruses. That means that 90% of any taken samples, we know they are viruses, but we have no idea what kind. Whether they are bacteriophages, which is likely, but there can be human pathogens, there can be zoonotic pathogens, animal pathogens. We have absolutely no idea. And one can argue that if we don't yet know what it is, it might not be, causing severe symptoms. It's not a big deal. But if you think about, there was a common cold virus 4 years ago, which evolved overnight and caused a pandemic and resulted in the death of millions of people and affected everyone's life really on the planet. So it would be good to know what's in there now and be proactive about the actions that we can take. That's the first one. The second would be, I think, better understand the infectivity of these entities in water, which is really hard, especially for viruses, as there are no culturing methods available for their monitoring. And that's true for some bacteria and fungi as well. It's just the detection and the infectivity of these pathogens in water, which is such a difficult matrix, can be really, really hard. So this is something to focus on as well, I think. And then when we have enough data on this, we can use these amazing tools that we already have in mathematical modeling and AI to model and estimate the risks associated with waterborne diseases, which areas are affected, when they are affected, how long you shouldn't use a water body after a storm, for instance. But for that, we do need the actual data, and not just the current data, but the trends as well. As you may know, most research projects in academia, 3 years, 5 years tops, which is great. But environmental pollution, global warming, that's not 3 years, that's decades. And we could use decades-long data to analyze the trends of these pathogens in water or in any other environment, really to feed these models and have a better idea on this for the protection of not only the next generation, but the generation after and any future generations. Thank you.
Thank you, Kata. And we have a question about your views on the current monitoring efforts. I think we will come back to the monitoring and the knowledge of what's actually in water, but. Okay, thank you. But let me just finish this round of questions. And what was mentioned today in the plenary session was the importance of interdisciplinarity, and there was also a question of qualitative research raised and how can we use it. So I wanted to ask you, Hans, because Eurofound are conducting a lot of social surveys across Europe. So how would you see the role of organizations like yours that are mainly engaging in social research in helping us to understand this climate change impacts on health and responses? How can we actually link the social research with the type of research that Kata does, for example? Are they two completely irreconcilable beasts, or could it be put together somehow? So I would love to hear from you on that.
Well, yes, you previously said that our research has not focused on climate change. That's true. Optimistically, we have worked more on policies to prevent it. And that relates to what was said during the first plenary session, that there are silos, like people working on mitigation measures and people working on adaptation. So it's I think this session is good in bringing them together. Also, now we have mainly focused on the socio-economic impacts of these mitigation measures and how to prevent that groups that are already in vulnerable situations are impacted more in terms of job loss and income by the green transition. Now, in the plenary, there were also examples given of policies which, on the one hand, improve health. So, for instance, low-carbon diets, or active transportation, and at the same time are good for climate. Well, I invite you to look at Eurofound poster presentation. It looks at triple win policies, because you could call it a win-win policies, good for health and the environment. We also look at policies which are not only good for health, not only good for climate, but also good for household finances. Now, in relation to water, I was also thinking, could you think of a triple win policy in relation to water? And I thought, yes, you could think of one. For instance, if you facilitate high-quality drinking water from the tap, and to ensure that people choose that option instead of bottled water, unhealthier alternatives, for instance, with VAT mechanisms and so on, you could steer, you could get one of these triple win policies in the area of water as well. Now, there's many research gaps in this policy area, such as was also mentioned in the plenary, and also in how to scale them up. However, so there was a call for more evaluation of policies, but I think from some policies you also know that they're good. You don't need to evaluate them, but it's interesting, it's useful to see wider or how to scale them up more than that. Now, besides our multi-method in-depth studies on policies, we indeed have our population-wide surveys, and they can provide an important link. We have our European Working Conditions Survey, also looking at working conditions in greening economies, but especially in this context, the European Quality of Life Survey, the EQLS as we call it, is relevant in this regard. It already for 20 years, it looks at it was rather innovative because it looked at progress beyond economic growth alone. So and the environment fits really well in this beyond growth perspective. And indeed, EQLS has included questions on housing quality, energy poverty, transport poverty. There was a question on water quality as well up until 2007. And the quality of the environment, quality of the air. These are perceptions, but they're important for mental health, etc. Now, we are currently designing the new questionnaire for the 2026 round, and it will reflect the new challenges that Europe faces in terms of social justice, democracy, digitalization, but also the green transition. So, well, we don't know yet precisely what will be asked. It will certainly have a larger focus on the issues which could be linked to those discussed during this conference. And we really invite researchers to draw on all these resources, or policy database, but also the microdata of our surveys, in particular when the new one becomes available.
Thank you, Hans. So we are looking forward to the survey, that results of which will be available probably in 3 years' time also.
Yes, 2027.
Long-term planning. The final question from my side to Luca, and looking a bit more into the responses or adaptation options as per the second question we can see on the screen. Looking at the water supply and also wastewater treatment systems in the future under the changing climate, what would you see as the main actions? How can the problems be solved now, in a slightly longer term, and in the decades? And who would be ideally involved in solving those questions or those problems? Which stakeholders would you like to see on board?
Yes. As last question is not the easiest, because when we talk about solutions, we should really necessarily talk about research, and water is really a fascinating matter also for research. As an example, during COVID we were sure for the support of drinking water and sanitation for prevention of transmission of the virus, of the hygienic measures, but we also started to explore and to expand the wastewater epidemiology to track the virus, and now we are going beyond the virus to track many other pathogens, and it was done in a couple of years. But this situation is more complicated because there is not research, not laboratory only, but lots of sectors, because when we think about I see some interesting questions also from Slido about the chemical contamination. Yes, it's of course many kind of contaminants can be exacerbated by climate change, and the solution is who pay for treatment, because solutions are there, but if we want water free or from microplastic or perfluoroalkyl compounds that are the basis of our lifestyle, we should decide that a piece of this payment should be paid by producers. So once again, water should benefit from other sectors, and really the solution for adaptation is really the partnership, the cooperation that sometimes should be also forced, but should be realized. Otherwise, we risk to forget some piece of solutions. Fortunately, we can rely upon sound methodologies, which are risk analysis now very effective, water safety plans, sanitation safety planning, that are standard for approaching in a multidisciplinary and multisectoral vision the resiliency. And the other message is that we can't think only to water, because when we talk about climate change, we had lots of problems together, but also solutions. Just water, just to think how much we should be flexible as health professionals. In the last extreme event of flooding in Emilia-Romagna began in the same way in which the special commissioner for drought for the same region was named, and our scenario of risk changed dramatically in a couple of weeks, because we passed to examine lots of pathogens that due to the contamination from wastewater to all kind of water and direct exposure of population, we had to think to pathogens that we considered eliminated and for which vaccines were not in place. So the flexibility of all the sectors should be high. But let me to conclude that some good action could be done, and as an example, in Italy there was a national law that created the National Center for Water Safety that has the main scope to to concentrate the efforts of many sectors. And in doing this, many other instruments are available, such as the Protocol on Water and Health, that is a formal partnership under a wide umbrella.
Thank you so much, Luca, and I think it's a really valid point that the quality of our water is the effect of so many various activities that are happening, that maybe the creative use of the existing tools to minimize the pollution would be the way to go. I'm looking at the Slido questions, and sorry, Hans, did you want to say something?
Well, I was also looking at these Slido questions, but there was one which I cannot see there, but I can see it here, and that's, can I? Or,
Yeah,
because
go ahead.
as regards climate change, water scarcity is a major risk for most of Southern Europe and is very poorly researched. I think a panel on water should cover more this issue, so water scarcity. I don't know who raised it, but yeah, that's I think that's a very valid point, and yeah, I can only say it's not only for Southern Europe. There in the policy database we have also from Northern Europe, several countries which try to react to certain areas, certain periods when there's water scarcity, to try to prevent that and to address it. We as Eurofound, I think so far we have only looked at it from the perspective of the users. So if people have access to services like to water, if they're able to pay for it, things like that. So, but there may be others.
Can I just add that formally water scarcity is a nonsense, because the quantity of water is always the same, fortunately, from the beginning of the planet. But what we consume is the quality of water. It's not also the quantity, but the quality of the quantity. We should think about this also when we use or reuse the water. That could be really a great solution.
Okay. As a moderator, I feel I need to step in here and prevent the lengthy discussion on that. But indeed, we haven't been able to cover all the themes in the session. If I can just say something, the European Environment Agency will be publishing a report specifically looking at the climate change impacts on health via floods, droughts, and water quality as well in May. So we're hoping to hopefully address some of those issues. But back to the Slido questions, I think Luca and Kata, it would be great to hear your perspectives, both from the national perspective as well as from the researcher perspective on the current monitoring efforts. So what do you think, how are we doing in terms of the methodology, frequency, data accessibility, and what could be done to improve it? So over to both of you.
I start then, and you can jump in. I think there's room to improve, for sure. Like bathing water, currently we only monitor E. coli and enterococci, and that is the basis of bathing water quality, which is great because we have something to hold on to, and we have decades-long data. But those indicators are not always representative of, for instance, viruses or fungal diseases or other pathogens. So there's definitely room to improve in terms of methodology and frequency to have more actual pathogens within the panel with really good methods. We also work on like sensors which could be used to estimate bathing water quality, or also like lateral flow kind of devices which you can actually use on site to detect certain viruses in bathing water. I think data accessibility is quite good actually. that data that is available on bathing water is available for everyone. It has been quite easy for us to get access to EU data and UK data for research purposes. I assume it is for other purposes as well. It's just there, isn't it? Which is great because that is what we need for modeling and mitigation.
I can just add that there is the trend in order to perceive the changes in water, to apply online systems and early warning systems. That is really an important trend. These kind of instruments are more and more specific, but essentially they can detect in real time change of many general parameters of water, such as conductivity, turbidity. That is one of the key parameters for quality and for the effectiveness of disinfection, and other parameters that can move together. Once again, these systems should be coupled with good information system, because we should discriminate false and real threats to the quality of drinking water. But this is important because when we know the state of our water, source water, facing different climate change drivers, we can understand what kind of risk is present in real time, and sometimes is the key for adaptation and also response.
Thank you both. The next question from Tim Taylor is about the key adaptation options and what gaps exist in the evidence. So, any takers for that question?
Just once again, there is no a solution. When I talk about, I stressed the concept of water scarcity. I understand that in some region there is really water scarcity because water is disappearing for a long period, and the index is really high. But in that kind of regions, there could be not one solution. Some new solution we talked about can arrive from new technologies, and desalination is really a great opportunity, even if we need of green energy and other environmental and we have to manage other environmental concerns that are the brackish water, the salt water wasted by the plants. But other solutions are really old. We think to smart solution as just as a new solution, solution of the future. But many islands have a lot of reservoirs that could be really real solutions for avoiding that drinking water is used for irrigation or for agriculture. So once again, from a wider point of view, we can realize reservoirs, because now the kind of precipitation is really in a rare, in many cases rare but extreme. So we have to collect this water that is not going to go as to recharge groundwater. So system of reservoirs could be another solutions, and reuse is really another solution for which research has to demonstrate. But in this case, we have not only research and reuse and technique, but also information and communication is important, because some people could be concerned about food produced with reused water. So once again, partnership is the solution.
Thank you. We are coming to the close of the session. I think we well deserve dinner and a drink now, but maybe if I could just ask a final question for Kata. The question that is at the bottom of the screen, whether you would see the climate change impacts on water more in the microbiological sphere or in the chemical sphere. And also, Luca, you can comment on that.
I think we need a more holistic.
Strange, they are connected.
I think we need a more holistic approach and focus on where the contamination is coming from. Because, like, if you think about wastewater, you have human pathogens, you have pharmaceuticals, antibiotics, phosphor, nitrate, all of those coming from one source. So ideally, I think a proper monitoring system should include them all in order to track the source of the contamination and also to estimate the magnitude of contamination as well. And I always talk about viruses. I'm a virologist. Like, what do you expect? Of course, I'm focused on it. But yeah, there are extreme cases where chemical safety is just horrendous. If you allow me just a quick story, there was this mental health institute, I'm not telling where, but in a developed country, and their waste kind of ended up in a river directly without any treatment. And because of all the tranquilizers in the waste, the fish living there got so stoned, they actually died of starvation because they forgot to eat. So yeah, chemical safety, microbiological safety should really go hand in hand. Thank you.
Yes, just once again to think together. When we have heat waves, we have also a higher content of drugs residue exiting from wastewater treatments, just to give an example. But it's more easy to understand that when we have flooding, the chemical risk is very high. But also with fires, we have a lot of problems related to use of some foams, but also kind of and sometimes the kind of contaminants are not unknown, but very little known, and there are not specific methodology. So we need also to have time to research for prevention and response once again.
Thank you so much, and let's give a big round of applause to our panelists. And thank you for your perseverance and for the questions, and let's go and have a drink.